Hello, I'm Dr. Mark Lindholm from Natural Health Family Chiropractic, and I want to welcome you back to our second part in a series on headaches. In part one of our video series, we looked at the different types of headaches, especially looking at migraine headaches and muscle tension headaches. And we looked at their relative prevalence, how often those types of headaches occur. And then we spent a fair amount of time looking at the effectiveness of chiropractic care or chiropractic treatment in dealing with headaches. And we looked at some of the research that's been done that shows the effectiveness of chiropractic care. So today we're going to look further at treatment approaches, including chiropractic care, but also looking at other natural approaches and even preventative things that you might not be aware of if you're somebody that suffers with headaches or if you have a friend or loved one that suffers from headaches. So let's take a closer look at what chiropractors do to help patients with headaches. The most powerful thing we do as chiropractors is we adjust the spine to improve the function of the nervous system as it comes through the spine. This is important for many health conditions or just really for you to be your best. But it's especially important with headaches because most headaches have a neurological origin. And this is true whether we're looking at muscle tension headaches or we're looking at migraine headaches. So in part one of our video, we talked about the effectiveness of chiropractic care for treatment of headaches. The research is clear, and my clinical experience would bear this out also, that we find that some patients get almost instant relief of headaches after we adjust them. And the research shows that chiropractic care often helps to reduce the frequency of headaches, the duration of the headache, as well as the intensity of the headache. But today I want to talk a little bit more about other natural approaches for helping with headaches. One of the things that's great about chiropractors is we have an emphasis on a natural approach to health, holistic effects. The first thing I want to talk about is the use of massage and how that can benefit headaches. Especially muscle tension headaches many times respond wonderfully to massage. And we find that there's a beneficial effect of combining massage and chiropractic care together that gives us a exponential improvement over using either of them alone. Massage directly in that way can help to relax the muscles, help with blood flow, especially with TMJ and muscle tension types of headaches. Massage can be really helpful. But we also find that massage is also great as a stress reduction technique. Now it's much more than just pampering yourself for stress reduction, but it's undeniable that just the human touch of massage can really relax patients, and that's can't be overlooked as a source of headaches is just our stress-filled world. So massage is something that many times along with chiropractic care or sometimes even just all by itself can be very, very beneficial from people that suffer from headaches. The next thing I want to look at is simply your posture or your alignment. When we're looking at headaches, your posture is really critical. A common problem that we find is that many of our patients have a forward head posture. The normal posture of the head and neck is your head should be over your shoulders, your chin should be up, so that when you look at somebody from the side, they should have a forward arc. It's called a lordosis in your neck. Many people, though, have a forward head posture where their head is forward. And this can commonly just result from everyday activities we do where we're looking down a lot, whether you're a student looking down at books all day long, whether you're looking down working at a desk, looking at a computer, even now walking around looking at a smartphone during the day. So the way that posture can affect you is there's multiple ways that it can affect you. What we find is that when your head comes forward, one of the things that it does is it tends to put extra stress on the nerves that come through the spine. That normal lordosis, or that arc in your neck, actually gives the best protection for the nerves. When your head comes forward and that lordosis is reduced or straightened out, or in many cases, unfortunately, reversed, it really has a stretching or a tension effect on the spinal cord or the continuation of the brainstem that comes down into the neck. And that can many times be a causative factor in migraine headaches because of the way the neurology from the top part of the neck and the brainstem feeds back up into the brain and even feeds into the trigeminal nerve, which comes around into the face. So posture is really, really critical. Many times some of our adjusting that we do on patients is specifically designed to remove nerve interference, but also to correct that posture. But it's something that you can be aware of yourself just with your everyday activities. Also from a muscle tension headache aspect, we find that if your posture is not good, it greatly increases this tension on the muscles. We actually know that a forward head posture, we know mathematically that for every inch that the head translates forward, it makes the head feel twice as heavy. It's called lengthening the lever arm. As the head gets further out over the fulcrum, it magnifies the amount of force it takes to hold it up. So if the average adult's head is 10 to 12 pounds, if your head is only shifted forward just 1 inch, say looking at some paperwork at your desk or working on a computer, it can easily make you feel like you're walking around with a 20 to 24 pound head. Now multiply that even further if your head is 2 inches forward or 3 inches forward, as it would commonly be looking down doing work. It can make you feel like you're walking around with a 50 or 60 pound head, or sitting, with a 50 or 60 pound head. And so that can really tighten up those muscles, cause constriction through that area, and definitely be a big causative factor with leading to headaches. So we want to sit up tall, sit up straight, think about having that good arc in our neck. And I commonly tell people to take micro breaks. If you're doing work where you have to be bent forward to some degree, every half an hour take a break to stretch your neck back, realign your posture, and to reset that good posture to help to prevent that repetitive stress of that forward head posture. The next thing I want to look at is really something that's pretty simple but can have a profound effect on headaches, and that's ensuring that you're well hydrated. The average person needs to be consuming about half of their body weight in ounces of water a day. Now, for a lot of people, that sounds like a lot, but it's really not if you do it correctly, if you have a system or a procedure for staying hydrated. You should start off each day with a big glass of water. Water is what you should drink most of the time. I encourage patients, if they haven't been drinking much water, to actually measure out that amount of water. So if you're a 200-pound man, that would mean you're going to consume 100 ounces of water a day. So that could be 10-ounce bottles of water or glasses of water, or it could mean that you actually measure it out in a container. What I personally do is I have a glass decanter that I fill with water. It's about 1.5 liters, and my goal every day is I fill that up, and my goal is to consume that in the morning when I'm treating patients before lunch, and then I fill it up again in the afternoon, and my goal again in the afternoon is to consume that again. So measuring it out can be important at first, and adequate hydration is so important for all of your bodily functions, but especially for detoxification. So we find that people that aren't detoxing well many times are prone to headaches. Also, just all of your cellular reactions need water to work correctly. So it's a really simple solution that can help not only with headaches, but really can be a good thing for improving your overall health too. Next, I want to briefly talk about nutrition. And I have to say, first of all, that nutrition is a big topic. And if you want more detailed information about nutrition and about some of the things that I'm going to talk about in the next couple sections, look at my video, my grocery store tour video that is also on our YouTube channel, because it's about an hour long, and I really can't condense all of that information into just this short video. And we really are able to delve into, as we walk through the grocery store, the ins and outs of nutrition and things that you should try to eat and things you should avoid. So just to summarize here today, we want to think about adding a positive. Too many people think about nutrition or about diet as if it's a punishment almost, that they're having to avoid eating things and they're having to limit themselves. But we really want to think about adding all the good stuff. We want to add lots of greens, lots of brightly colored vegetables especially should be the basis of your diet. There's so much research that shows that green leafy vegetables give you the most nutrients, and especially magnesium and calcium, and some of those nutrients are really important for headaches. We also know that foods that are high in fiber, again, help with detoxification. You're just going to get more of the nutrients that you need for your body to work well, and so you're also going to probably be avoiding some of the bad stuff just because you're not going to have room to eat the bad stuff if you're filling up with the good stuff. So lots of green leafy vegetables, lots of brightly colored fruits. You want to eat the rainbow of fruits and vegetables. In other words, trying to eat a diversity of fruits and vegetables so you get different nutrients. Brightly colored fruits and vegetables tend to have more nutrients than bland or white things. We also want to make sure, though, that we're getting adequate protein and adequate healthy fats. A lot of people are scared to eat fats. They think of fats as being bad, or that fats cause you to be fat, and that's really not true. We want to avoid some fats, but we want to make sure we get adequate healthy fats. It's really important for our body to function correctly, especially when we look at inflammation, which is really sometimes a big problem with headaches and just with chronic health problems in general. And beneficial fats, especially omega-3 fats and omega-6 fats, tend to actually be anti-inflammatory in your body. So every meal you should have a diversity of fruits and vegetables. You should have some lean, good, high-quality protein that's not overly processed, and you should purposely have some healthy fats, things like avocados or nuts or seeds or cold water fish that's loaded with omega-3 fats. Those kinds of things you want to purposely add into your diet. Although my overwhelming approach with nutrition is to add the positives, there are a few potentially negative things that you should really be aware of, especially as it pertains to headaches. The first thing on my list of things that you should avoid are artificial sweeteners. The most common ones that are in our diet are NutraSweet and Splenda. So this would mean avoiding diet sodas, a lot of candies and gums. And actually nowadays you really have to look carefully because NutraSweet and Splenda are in many everyday food products that you wouldn't even think about. So there's a lot of, I could talk for quite a while about the potential health risks from artificial sweeteners, but especially if you're prone to regular headaches and you're consuming diet sodas or these kinds of things, you should avoid them. I personally think that you're better off without them anyway, just when we look at your overall health, when we look at trying to prevent cancer, when we look at trying to maintain a healthy weight, because there's actually some research that shows that a diet high in aspartame, which is the ingredient from NutraSweet, actually increases appetite, which is just ironic when it's put in many diet foods. So there's a lot of other reasons, but I've commonly had patients where when they cut out diet sodas and cut out artificial sweeteners, that their headaches just disappeared. So that would be the first thing on my list. The next thing are overly processed foods, because many of these, again, contain chemicals that can sometimes trigger reactions as far as headaches. So this could mean things like processed, like junk food, things like chips and processed meats, especially nitrates that are commonly found in processed like deli meats are notorious for being a trigger for especially migraine headaches. Also MSG and those kinds of flavor enhancers, which are commonly found in processed foods, for many people can be a trigger for migraine headaches, as well as sometimes muscle tension headaches. We also need to look at things that might just be a trigger just for you. In other words, food sensitivities or food allergies. The most common food sensitivities or food allergies are wheat, especially the gluten part of the wheat, things like soy, dairy, corn. So those are the things you might want to start with. You might want to think about if just doing an elimination diet, or another really great strategic thing can be keeping a headache diary, or a diary of when your headaches occur, and tying that to not only the foods you eat, but also were you under a bunch of stress right then. For women, maybe where were you at in your cycle? Maybe our hormonal shifts leading to the headaches. So a diary can often be good, but especially when we're looking at possible food sensitivities, sometimes that can be a good strategy to keep a food log or a diary. Many people, though, it can be very complicated to figure that out. So actually doing food allergy testing, which is something that we facilitate through our clinic, can be really beneficial for knowing exactly which foods you might be sensitive to, and then eliminating those from your diet. Many times we do an elimination diet over a 1 to maybe 3 month period of time. By avoiding those foods, you can decrease your sensitivity, and then many times you can go back to eating those foods. If you have a true allergy, sometimes the foods have to be avoided indefinitely, but many times if you avoid them for a period of time, your body will overcome that sensitivity, and then you can reintroduce them into your diet on a rotational basis. I commonly have patients ask me about supplements and what kind of supplements should they take to help with headaches, and I want to first look at the supplements that you should take to really be healthy, because that's going to, if you improve your overall health, that's in many cases going to lead to a decrease in your headaches. So everybody really, as a basic nutritional strategy, should be taking a good high quality multiple vitamin and mineral supplement. They should be taking omega-3 fats or beneficial fats in the form of krill oil or fish oil. They should be taking a probiotic or a beneficial bacteria on a daily basis to help with the inoculation of the good healthy bacteria in your digestive system. And most people where we live in northern Indiana should be taking a vitamin D supplement every day. Ideally, we have really good results with a micellized or liquid version of vitamin D that's readily absorbable. So those are the basic things that you should be doing every day, and many times those alone will give you what you need nutritionally. But some specific things that patients might need to take an extra amount of would be, number one, magnesium. We find that magnesium deficiencies can many times lead to muscle tension problems and specifically lead to headaches. We also find that people get benefits from taking extra B vitamins. It can be a B complex. We sell one called glycogenics, which is excellent through Metagenics. Sometimes we find people with migraines can really benefit from extra B12. Again, that comes in a liquid form that's a sublingual, under your tongue kind of administration that helps that to be absorbed. B2 or riboflavin many times can help with headaches also. And then the last supplement I want to mention is coenzyme Q. And coenzyme Q is really important as an antioxidant. It also, if you're somebody that takes cholesterol medicine, one of the side effects of cholesterol medicine is that it oftentimes depletes your body of coenzyme Q. So it's something that, especially if you're taking a cholesterol medicine to a statin drug to lower your cholesterol, you should be supplementing your diet with coenzyme Q on a daily basis. Another really important natural strategy for dealing with headaches is to look at your stress levels. This is so important, as we find that stress many times leads to especially muscle tension headaches, and also leads to migraines, sometimes directly and sometimes by actually tightening up the muscles and pulling the spine out of place and leading to subluxations or nerve irritation, as we mentioned. So stress really is a big topic to discuss in this short video. The good news is that our topic for next month is going to be stress. So we're going to release 3, maybe 4 videos specifically looking in more detail at stress and how stress affects you, how it affects your physiology. But also we're going to talk a lot about some natural strategies for dealing with stress, not only to help with headaches, but to help with your overall health, and even to help people that have really serious stress that might lead to depression or anxiety or those kinds of things. So tune back into us next month, and you'll be able to get a lot more information about how to deal with stress. So thank you for watching today. Again, I'm Dr. Mark Lindholm from Natural Health Family Chiropractic, and our contact information will be at the end. Please share this information with others, with friends or loved ones that may suffer from headaches, or if you yourself have headaches, please contact our office. We'd be happy to do an evaluation and talk to you personally about how we might be able to not only help you with headaches, but hopefully improve your overall health through safe, natural, effective approaches that we utilize at our chiropractic clinic. Thank you.